All right, back in studio live with Dallas County Health Director Zach Thompson. Again, thank you for coming in on this. This is busy night. All right, we left off, and I think we want to get back into it. We heard the CDC spokesman said 100% of these passengers, their temperature is taken before they get on any plane to the United States. Well, it didn't work this time, and you've expressed some dissatisfaction with what happens on the other end of these planes and how these potentially infected people are tested.
I think you have to look at what's going on in the African country in terms of people entering the airport there and then flying to the United States. We really have to take a hard stance and look at whether or not we need to assess people coming into this country and a time period before them accessing the United States. Based on the fact that Dallas County has the first reported Ebola case in the United States, then I believe that we should recommend that there should be a moratorium and an assessment of what's going on over there in Africa so we can be sure that people who are coming here are not carrying the virus. I understand he may have been asymptomatic when he got ready to enter the plane, but what we have today is a confirmed case.
And you're saying a moratorium to figure out maybe a different plan or something?
I think you're going to.
That didn't work.
And again, in this case, we got a confirmed case.
Yeah, got it.
But the number of confirmed cases that you have in Africa tells us, in terms of travel, we really have to reassess how people are evaluated before they get on the plane. And I think based on this episode, it gives a textbook case to why we have to relook at it.
And you said, that, not to be too pessimistic, but there's no doubt there'll be more like this.
I think we have to be very frank with Dallas County residents. The fact that you have a confirmed case and the possible contact with family members, we have to expect that there may be another case.
You also mentioned maybe some kind of holding. Would another option be they come in and we have to keep them isolated for 21 days to make sure they're not sick? I mean, that would be difficult, but I guess it might work.
Well, we're talking about third world medicine versus first world medicine. I'll take my chance with the United States and the public health system here in terms of the assessment.
Right, and we don't really have control on that end at all. What happens? We can really control this end, but not that end.
And I think that's where I would put my money on this end.
All right, let's talk about what's going to happen. You talked about the CDC hitting the ground tomorrow going. They're going to start following those trees of contact, right? Every place this person might have been, they're going to shoot out.
Starting with family, starting with friends, starting with the paramedics. Everyone is a part of this discussion in terms of contacts. And from that aspect, then you expand it out to see how far it goes, and then you bring it back to look at reducing the number. Right now we're saying it started out with 3 to 6 people in the earlier press conference. Now I've heard 12. I think that number is a comfortable number, 12 to 18, and we have to assess those individuals. And that's what the epi staff from CDC will evaluate. And I have full confidence in the staff that we have at Dallas County Health and Human Services, led by Dr. Perkins, as well as the CDC team. They're trained in contact investigation.
How long does that take? Because it's my understanding from talking with Dr. Pepe that maybe about 7 days is when this thing, as early as 7 days, it can manifest, and then up to 21, and if it hasn't manifested, you're not sick. But the seventh day is tomorrow.
Right.
And so we got to start finding these people.
Well, and I think that's why that number is small. Immediate family members, the children of the patient, those are key components, and then any friends. And so we're talking about 2 to 21 day period. So we're coming up on the 7th day, but I think we have a confined number that we're looking at. That's why I keep going back to that 2.4 million. We're only talking 12 to 18 people or less. And so we know who these people are. We assess them, and at that point, get them the proper medical care that they need.
All right, so we're going to wrap this up. Again, I've told you people are concerned. I'm getting all kinds of emails. Can you get it from a mosquito bite? Can you do this? Can you do that? They see that ambulance being gone over, and they're concerned about the firefighters. They're concerned about all kinds of things. Let's first talk about the firefighters. They are on what's that, reverse?
Well, they're on the
reverse isolation,
and they're being observed during this period.
They're stuck in their house, basically. And you're observing them and their families.
That's correct.
In their house, in a contained environment, but it's comfortable.
And assessed, and CDC staff and our staff will evaluate, and they're primary providers. And at this point, we will see in the next 7 days if any symptoms show. But again, my understanding, they took precautions. And so we'll see in the next 7 days.
DFR emergency, that's the ambulance they transported patient one, I guess we'll call right now, and that's out of service. All right, so tell people, just give them some, washing their hands. If they wash their hands an extra time a day, does that keep them safe? I mean, you know what? People like to do something. A storm's coming, they like to go to the store and they get something. What's the advice to people in general? How can they just kind of gird up for this?
Well, what we plan on doing is giving an update daily on this situation.
Right.
Hopefully that will reduce the fears that we see. Right now, allow Dallas County, CDC, and the State Health Department to do the investigation and report back to the Dallas County citizens. Right now, you're in good hands. The fact that you got the CDC, the State Health Department, and Dallas County working on it.
And a small pool of people.
Exactly.
That might be involved here, right? Thank you very much.
Oh, thank you,
Thanks
Steve.
for all the information.
All right.
And I don't know what you're going to do, but the flying in, I know you're concerned about it. I'm anxious to see where you take that. Thank you.
Well, we'll have a discussion with the CDC about it.
Okay,
Thanks.
I like that. Thank you.